Thank you, Patty, for taking a moment to discuss some of the challenges and barriers that our Latino families who are involved with social services are faced with. We did a study in 2015 that really brought to light some of the major challenges and barriers. One of the biggest things that we discovered in this study was that as a whole, Latino children were among the slowest group to reunify with their families. And today, when we have so many Latino families who are involved in social services, we really need to raise awareness for social services and our service providers, professionals in the community to assist these families. So I'd like to take a few minutes and explore some of the major barriers and challenges that you've seen in your experience as well that came to light out of that 2015 study.
Well, as a social worker for the past 20 years and now a supervisor at Children and Family Services, I have definitely seen some of the barriers that the Latino families experience in this process of family reunification. So I think the obvious one is the language barrier. Many of our parents are monolingual Spanish speakers. That makes it very challenging. Although they are assigned a bilingual social worker, and there are many services that are offered in Spanish, it's still very difficult for parents. They receive a court report that is written in English, they go to court, and they do get a translator, but it's very difficult to understand the process, hear it at court one time translated. There's a lot of legal language, as you know. So the next one would be the level of education. A lot of the parents maybe have a third grade education, maybe primary school. And we do have parents that are illiterate. And so, providing them information, very, like I said, long court reports. So in court, it's going to be translated by an interpreter. The social worker will go over the information, specifically the case plan, which is what the parent is being asked to do. Services will be offered in Spanish. But in spite of this, it is very challenging for somebody who's maneuvering, speaking English. So one of the other things the study talked about was the cultural assimilation, the parents being at a different cultural assimilation than the children may be. That will present a case, with teenagers in a lot of cases. The financial barrier, the gender roles. We have many situations where the father or even both parents are working and they are trying to make ends meet. As you know, Orange County is extremely expensive. And so sometimes we have situations where the family is renting a room and they're all living in one very tight environment. And so that is very challenging for the family to be in that situation. When it comes to living with the parents, the biological parents, none of that is considered. The family, whatever they're able to provide for their children, that is sufficient as long as they're meeting the basic needs of the children. It becomes difficult when our agency is trying to place children with relatives or close family friends. If they are having the same tight quarters, then due to the licensing regulations, that could become a problem.
And when you think about it, we strive to, if we have to place a child, if we have to remove a child, we strive to place a child in their own community, in their own neighborhood, with their extended relatives.
I think for parents that are working with our agency, Latino parents specifically, there is that distrust of authority in many cases, if they're first generation especially, and their experiences in their country of origin. There's going to be that fear of working with our social workers and our staff. We find that relatives in some circumstances are also fearful of interacting with our agency. And in order to place children, there needs to be certain screenings. And so they don't want to provide their information. If they have renters, they don't want to provide the information. There is the fear that our agency is going to report them to immigration, that because they're involved with our social workers, they may be deported. And so that is something that families are afraid of, the parents as well as their extended family. Our agency doesn't share that information with immigration, but there is still that fear.
And it's that perception that because we are government and we are authority, it could prevent a relative or a family from taking the necessary steps to provide a place of family-related care.
And I think, we have encountered families, they don't want to be involved with us. Maybe they have heard things about social workers, and so they don't want to be involved, even taking care of their own family members, because they don't want to interact with the social worker.
So there's a negative perception.
Yes. So one of the things we find, for example, is, so if the family is undocumented, for example, they may not qualify, for example, for programs like CalWorks, and CalWorks could help with childcare, could help with transportation. So there's some services that they may not have access to, the family. And so that makes it very challenging. Another challenge, I think, or barrier would be transportation, navigating the bus routes, and having that accessibility if somebody doesn't have a car. And if you have to transport yourself by bus, then it's going to take a lot longer to get places, of course.
You can spend the whole day riding
and
a
people
bus.
do. Yes, they have to go from the parenting class, maybe to drug testing, to a visit that afternoon. And yes, it's very challenging if somebody does not have transportation in Orange County.
So single-use, single-location service provider that's multi-servicing
Absolutely.
is key and vital.
So one of the great resources that social workers use are the family resource centers in the community where the family lives, where they have access to parenting, PEP classes, after-school programs. They have a multitude of services there to support the family in their community, and that's a great resource that social workers use to connect families during their case and then also after the case.
What are some of the things that social services is doing and its community partners are doing, as well as to address those challenges and barriers?
The Eliminating Racial Disparity and Disproportionality work group is a partnership with Children and Family Services and many partner agencies. We have probation, the healthcare agency, behavioral health, and community partners that have been meeting monthly for many, many years. Yes, so we have a multitude of agencies that work with Children and Family Services in a work group called Eliminating Racial Disparity and Disproportionality. And the Mexican Consulate, I don't know if I said the Mexican Consulate, law enforcement, healthcare agency, mental health. So they've been meeting to talk about barriers. They were talking about barriers in the African American community. They are now talking about barriers in the Latino community. From these conversations, we have parent engagement efforts, father engagement efforts. Speaking Workers Forum is a agency-based group that is talking to address and look at challenges in the Latino community, and also educate staff as to resources and supports that are available to our clients.